Good morning.
Good morning.
Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
And today we're going to be asking Dr. Katzen all kinds of questions about you, weight loss patients, and surgery after massive weight loss. Are you ready?
Yep, let's do it.
Let's start from the very beginning. Someone's lost a significant amount of weight. What's the very first thing they should consider before thinking about plastic surgery?
So I think probably the most important thing is with weight loss is you need to have lost the weight, obviously, and then your weight needs to plateau, okay? So maybe you haven't reached your ideal body weight, or maybe you haven't reached your goal weight, but continue to diet, continue to exercise, continue to eat right, and your body is going to plateau at a certain number. Ideally, it's at your goal weight, but it may not be. Ideally, it's at your BMI of 30, but it may not be. We look at general trends with weight loss surgery. So as long as you're conscientiously eating right, exercising, and then your body's going to plateau. And then once your body plateaus, usually, and been stable for about 3 months, then I think you're probably ready to go for these plastic surgery procedures.
Speaking about plateaus, I feel like a lot of our patients say they plateau at a weight that is not necessarily their goal weight. What
Correct.
Can they then do?
And I think that happens to most patients, not some patients. I think it happens to more than 50%.
Oh, wow, okay.
That they plateau above their goal weight, above their BMI of 30.
So what do they do?
So other things that can be done, exercise harder, calorie count, minimal in, but then physiologically there's only so much the body can do. But there are also things we can do medically, like these GLP-1 injections, the tirzepatide, Zepbound, Ozempic, Wegovy, all those medications that can help further weight loss.
Yeah, because so many of our gastric bypass patients, they'll plateau at about 200, for example.
Yeah.
And then that they'll get to their goal weight of losing 30 more pounds with the Mounjaro or the weight loss medications.
Yeah, so the numbers are deceptive sometimes. I mean, some patients we have that come in the office and they are 280 pounds. And you'll say, wow, you need to lose more weight, you need to lose 100 pounds. But you may not realize that patient was over 600 pounds.
Right, so it's a lot of skin too.
Yeah, so a number and a height needs to be taken in context as to what their maximum weight used to be.
Right. That's why BMI isn't always the best judge.
So you need to look at the big picture.
What are the top signs a patient is ready mentally, physically, and medically for a body contouring after massive weight loss?
Well, mentally, it is a big step. It's sort of completing the weight loss journey. It's very important for you physically to have lost the weight. People that go into plastic surgery gaining weight or at not a good weight and need to lose more weight and can lose more weight should do so. So it's very important. Mentally, you're ready for these procedures. Mentally can be, making sure family's in order, animals in order, you have time off from work, things like that. Physically, you got to make sure you're not smoking, your other medical conditions are under control. So if you have diabetes, you got to make sure your hemoglobin A1C and your sugars are under control. Maybe your blood pressure problems are under control. So those are very important factors to consider before undergoing these procedures. Yeah, so medically, again, those medical conditions like diabetes, high blood pressure, make sure you don't smoke, things like that. Make sure those are under control.
And you run a bunch of tests before the surgery.
Oh, yeah. Before we do any surgery, we're going to test your blood, EKG, chest x-ray. Depending on your age, we may do a treadmill test, see the integrity of your heart. And we also may scan your carotid arteries in your neck to see if there's any plaque buildup, which could indicate you may be a higher risk for a stroke either during or after the procedure.
Got it. And a lot of people ask, do your patients gain weight after surgery? Usually not, and I think that's because that's part of the mentally being ready.
Correct.
And also it helps that you make them plateau and stay at that same weight for at least 3 months.
Correct.
So that their body is used to, and they're used to not gaining more weight.
Exactly.
All right. And it would be such a waste, right?
Yeah, absolutely. I mean, these plastic surgery procedures are expensive. There's an emotional toll. There are scars. You need to take time off from work. So all those factors go into a fairly large investment, emotionally, physically, financially. So it's a big step. So you need to sort of be prepared for it and be prepared for the surgery and then the aftermath too.
Yeah, I think that's why most of our patients are so successful is because they understand that investment that they made.
Yeah, they're dedicated to the cause.
Yeah. What are the most common procedures your patients typically need after massive weight loss?
Yeah, so when you lose weight, I'm always amazed. People lose weight differently. Okay, so some people lose it all in the tummy. Some people lose their butt. Some people keep their butt. Some people lose the hips, keep the hips. So the loss of fat is very different on every patient. Also, when you lose the fat, patients are more focused on certain areas than others. Okay,
Right.
so we take an intake, what areas bother you, and then I'll ask the patient what areas bother you the most. But by and large, male and female, typically it's the tummy area that bothers the patients the most. So typically we're doing either tummy tucks or extended tummy tucks or body lifts where we incorporate not only the tummy, but the hips and the buttocks and the pubic region in one surgery. All right. And then other body parts that are affected are the outer thighs, the inner thighs, the chest, male and female. Typically the males develop fat, and it's very tough for them to lose the fat. So they come into the office with excess skin and fat of the chest. Women typically lose a lot of fat in the breast, so typically they're going to need a breast lift and or maybe implants. Male and female, most females collect fat in the arms. Most men lose fat in the arms. So when we're doing an arm lift, typically on males we're removing mostly skin, and on females we're removing skin and fat. So those are the typical areas we get. Tummy, hips, buttocks, inner and outer thighs, the chest, male and female, and then the arms, and then also the back. The back can be affected many different ways. We saw a patient the other day who had lost about 160 pounds, and he has nothing but excess skin on the back. We have other patients where there's rolls of skin and fat on the back, and they need an excision.
So, the person's body shape, is that kind of like, is there any way you can change that when you lose weight? Because some people, when they lose weight, they still have an hourglass figure. They just have a lot of skin over that. And then some people, when they lose weight, they're shaped very differently.
Yeah, so you got to consider the structure of the body. There are bones, and then there are muscles on top of that, and then there's fat, and then there's skin. So there are many layers to this, all right? So as you lose the weight, the cavity underneath the muscle, rectus muscle, shrinks, the peritoneal cavity. That's the thing that makes your stomach stick out in part. And that area shrinks, all right? And then on top of that, you're going to have shrinking fat. So the shape of the body does definitely change. Also, you got to consider this hourglass figure. We have a lot of patients that say, I was much more shapely when I was, say, 450 pounds.
Right.
And that's because of the curves of the excess skin and the fat around the breast. Then it goes in a little bit of the hips, and then the curvature of the tummy and the hips going out again. So very curvy when you were massively overweight. But when then you lose the weight, you lose your curves, because a lot of the curves are due to excess skin and primarily excess fat.
And if people do want to get that hourglass figure after losing a bunch of weight, you can help with that?
Yeah, there are things we can do surgically, whether it's surgical contouring, where I do an incision down the side, and it's called actually an hourglassing procedure, where I really snatch in the waist and allow the breast area and the hip area to a little bit expand. We can also do fat transfer to the areas, maybe fat transfer to the hips. We can also do hip implants. We can do breast implants. We can do fat transfer to the breast. So there are areas we can snatch in with either the excision or the suction, and there are areas we can augment either with fat or implants.
Can you walk us through how you decide what to do first for the patient, like how we were just talking about tummy tuck, thigh lift, body?
Yeah, so the first thing we do is an intake form. It says on there, what areas bother you? And we mention all the body parts, and the patient circles all the body parts. So when the patient comes in, I have a general idea of what's bothering them, okay? Whether it's the tummy and the breast and the hips and the inner thigh and the back, etc. And then I ask them what bothers them the most. Typically on females, it's the tummy, hips, and buttocks. That's sort of the primary area. Usually the secondary area can either be the breast or the thighs, really depending on the patient. Occasionally we get the outlier saying my arms bother me the most. And that has to do with maybe clothes fitting, or maybe they're a teacher and the kids are looking at their arms all the time. So in those patients, we do perhaps the area that concerns them the most first. All right. Male patients, typically it's the tummy that bothers them the most, plus minus the chest, sometimes the inner thighs. But what I try to do is address the area that bothers them the most first, so we can get at least them happy about the procedure, happy about their body as we go down the surgical realm. So typically what we do is either a tummy tuck, extended tummy tuck, or even a body lift, and often that can be combined with your area of secondary concern. Maybe we're doing the body lift and thighs, maybe we're doing the body lift and arms, maybe we're doing the body lift and chest. It really depends on the severity of the excess skin and fat of the tummy, whether it's going to be a 4-hour body lift or whether it's going to be a 13-hour body lift. It really sort of depends.
You often talk about staging procedures. Why is it often important to break these up, like upper body, lower body?
Yeah, so in the history of reconstructive plastic surgery after massive weight loss, when it was first coming out, maybe about 25 years ago, we used to do all the body parts in one procedure. We used to do the arm lift and the face and the back and the body lift and the thighs in one procedure. And there would be maybe about 3 or 4 surgeons on each side of the table. So you'd have 6 to 8 surgeons on each side operating on you. And you'd be in the hospital for about a week to 10 days, multiple blood transfusions. And that's what we were doing. But we found that's much too invasive, too much trauma to the patient. So we've evolved now into staging these procedures. So what we like to do is we like to break these procedures up into maybe 3 or 4 or 5 sessions, depending on how many procedures we can do at one time safely.
What kind of transformation is possible after weight loss and reconstructive plastic surgery? And how do you help patients set realistic expectations?
So what kind of transformations? I mean, pretty amazing transformations.
I've seen some crazy stuff.
Yeah. So, very dramatic changes. And one thing I should stress, a lot of patients focus on, how much does this weigh? How much are you taking off?
Yeah.
What's the weight of the specimen? And you got to realize the procedures that I do are more shape surgeries. They're not weight surgeries. I'm not taking off, like 100 pounds or 150 pounds. Those are weight loss surgeries. Those are the gastric sleeves, the vertical gastric banding, maybe the Roux-en-Y gastric bypass procedure. Those are weight loss procedures. Those procedures help you lose a lot of weight. My procedures, they're giving you more shape surgeries. So that's very important, that these are more removal of excess skin and fat, not really removal of excess weight. Okay. And they're setting realistic expectations. That's why we have so many pictures on our website showing, I think on body lifts we have about 170 different patients, different shapes, different sizes.
Yeah, I agree. And even like the skill of what you can help them accomplish with their body.
Yeah.
I think even when you're standing here and you're like pulling their skin back and showing them, that really gives them a good idea of what their shape is going to look like after the surgery.
Absolutely.
Yeah, because you do remove as much as you can safely.
Absolutely. And one thing we get into sometimes post-operatively is body dysmorphia. Okay.
Yeah.
So sometimes after the surgery, we will get the patient looking amazing, snatched, looks, 10 out of 10, looks great. But when the patient looks in the mirror, they still see themselves as obese. And so that's something we have to work with the patient and help the patient through to realize, wow, you look so much better now, nice flat tummy, hips and buttocks, breasts, everything looks so much better. But conceptually, intellectually, the mind doesn't really see what the rest of us see.
Yeah, and I think it's like throughout their whole process of losing weight, they struggle with that body dysmorphia, and it just continues after.
Correct.
A lot of times, though, they say like they have moments where they'll look at themselves and be like, "That's not me,"
Correct.
And then they just don't believe it.
Yeah, they'll literally walk by a mirror and look in the mirror and go, "Whoa, who is that?"
Yeah,
and it takes a while for those patients. Like sometimes I've seen up to about a year for the mind to sort of catch up with the body and go, "Oh, okay, that is me," and I don't need to necessarily wear a 2X or a 3X anymore. I can wear, a medium or a large.
Speaking about, what kind of transformations are possible, I just like to look at our comments on YouTube or Instagram when people are saying, like, this person should have lost more weight before your surgery. But then they see the end results and they're like, oh, actually, never mind. Because, like, there are times where the patient does look like they could have lost more weight, but when you actually see them after the surgery, they're like, oh, they're actually really skinny.
Yeah, skinny underneath. And you got to realize, too, these patients are exercising. They are minimizing caloric intake, but there's only so much the body can do. It's not like you can say, oh, I want to lose another 40 pounds.
Right.
The body sometimes just physiologically cannot do that. So it'd be nice to lose 40 pounds, but sometimes your body just physically can't do that.
Yeah. And then that's a message to those of you leaving those comments, because
Yeah, it's not true.
It's not true, and they
Yeah.
can't work off the excess skin.
Correct.
So, are there risks or challenges unique to weight loss patients that people might not expect?
Like
healing or...
Yeah. So weight loss patients are prone to complications after surgery.
Okay.
Weight loss patients have an increased chance of wound healing problems, about 20% higher than the average patient that had not lost a significant amount of weight. And we're talking about weight loss patients of like 100 pounds or more. All right.
Okay.
And if you look at some papers in the medical literature, plastic surgery after massive weight loss, like 100 pounds or more, about 70% of patients will have wound healing problems.
Why?
Okay.
Yeah.
Has to do probably with absorption of micronutrients in the stomach. Okay. Also, poor eating. I mean, that's what got them in the situation to begin with. Sometimes anemia due to the gastric bypass procedures. Their hemoglobin is low, so hemoglobin delivers oxygen. Oxygen helps tissues to heal. So if you're not delivering oxygen because the hemoglobin is low, perhaps you're not going to heal up too well. Also, the microvitamins like vitamin B12 can be inhibited because of some of the gastric bypass procedures. All those go into poor wound healing.
So what can they do, or what can you do, or what do you guys do to avoid it?
So we make sure the patient is nutritionally maximized. We try to push about 100 grams of protein post-operatively. That's on a daily basis. We get that in with shakes. It's very important for your body to get those nutrients in the forms of protein to heal. You got to realize some patients think, oh, I'm just sitting in bed. I don't want to gain any weight. I'm not going to eat much. But you got to realize your body's working overtime to help everything heal. There are a lot of calories expended on the wound healing process in these large procedures.
Oh, calories expended.
Absolutely.
Huh.
Think of the calories needed to heal a wound. It's massive.
That's another thing that I hear patients struggle with is like patients that have had like some sort of gastric bypass surgery struggle to even get all that food in as they're healing because their stomachs are so small.
Yeah, so they have to get that food in, otherwise they're not going to heal. So we have patients, some patients, majority of my patients follow the rules. They get that 100 grams of protein in. But some patients, just don't follow the rules and they don't heal. And once we finally convince them, you got to get that protein in, they start to get the 100 grams in. And within a couple of days, like 48 hours, you can see the wounds get better. So you just got to get in that protein.
Yeah.
Very essential.
Let's talk scars. What can patients expect and how do you minimize them?
Yeah, so basically, again, scars. It's basically a trade-off. You're trading skin in for a scar, okay? Most of my patients are very willing to get rid of the skin in exchange for a scar. And there are a lot of things that can go into a scar. The scars are when I remove the skin, put it back together, and there are things that go into the final appearance of the scar. It has to do with the sutures, it has to do with the tension, it has to do with the patient's genetics, it has to do with the patient's care of the scar afterwards. Are they going out in the sun? Are they exercising too early? Are they stretching the scar? As well as the whole genetic component to it. All right. But things that can help with the scars that we do for all patients. Silicone cream. Silicone has been proven medically to be the best thing for scars. Better than bio oils, better than the vitamin E, medically proven silicone, okay? So we like to use silicone on the scars. Also, we like to use the silicone tape or the silicone strips on the scars. And ideally, we like to put that on for about 2 years.
Oh, wow.
That's a long time. Most of our patients, after about 6 months, are like, hey, I'm done with it. I'm happy with the scars. But if you can do it for 2 years, that's sort of the maximum time that the scar is basically breaking down, remodeling. It does that for about 2 years. And then after about 2 years, the scar that you have is the scar that you get. All right. Now, before that time, plastic surgeons can sort of intervene. We can remodel scars, and the ways we can remodel scars include things like injections of perhaps steroids. Okay, perhaps we're injecting Kenalog or 5-FU. These are products which decrease the body's hyperactivity and making too much scar. Okay.
And that's how a keloid could happen?
Keloid, yeah.
Okay.
Keloid basically is too much scar.
Yeah.
Okay, so if you think, the way I think about a keloid, it looks like a cauliflower. It grows outside the boundaries. So if you run your finger over a scar, it should be nice and smooth. If you run your finger over a scar and there's like a speed bump, it could be a keloid, okay? We have a lot of patients come in the office saying, oh, I have a keloid from previous surgeries. And when you look at it, it's not a keloid. It's a thickened scar, but it's not a keloid. A keloid, again, outgrows the normal boundaries of the scar. It looks like a piece of cauliflower stuck to the skin. By and large, in my practice, 25 years, I can only think of maybe 2 patients that have ever had a keloid. One came in with keloids, okay, and we did her tummy tuck, and she was very happy she had the tummy tuck, but she developed a little bit of a keloid on the scar, but she got rid of all the skin. And the other one developed a keloid on her arms after the scars. But that's thousands of patients. So keloids are exceedingly rare in our practice. Okay, but if you do have a scar, we can inject it with steroids, as we talked about. You can do microneedling, which helps to break down the scar and remodel the scar, if you will. There's a Morpheus 8 machine, which goes into the scar with needles to break down the scar, and also uses electric current, to shock the scar to help break up the scar. Another thing we can do for the scars are Fraxel lasers, or a variety of lasers we can use, which also help to remodel the scar. Fraxel is a type of CO2 laser which helps to basically break down the scar and helps your body to reheal the scar.
Most times your patients don't need any
Correct.
kind of scar treatment,
yeah, by and large,
besides the silicone strips.
Yeah, I would say about 99% of the time our patients don't need any ancillary scar treatment because they're very happy with the results and they're very happy with the silicone and the silicone tape that we use.
But also, what do you do, like, technique-wise to make these scars so nice?
Yeah, again, it has to do with minimal tension on the skin. So if you think about the skin, if this is the wound, and deep down here, we have the deep fascial layers, and then we have the fat, and then the skin coming up to the top. If you just put a layer of sutures at the top of the skin, there's going to be a lot of tension on that skin, and the scar is going to separate. So the more tension you can take off the skin, the less the scar is going to be. So if you put all the tension at the bottom of the scar with big heavy sutures and then just bring the skin together like that, there'll be minimal tension on the skin. So a lot of my patients will see the wounds or the scars raising up after the surgery, and that's because there's minimal tension on the incision because all the tension is below. I primarily use absorbable dissolvable stitches, okay? So after time, as that scar heals, those sutures dissolve away, and then that scar flattens out nicely and there's no tension on the skin. So it depends on the tension in the wound. It depends on the sutures that we use. It depends on the patient's genetics. It depends on the patient's care of the wound afterwards. Are they getting up and down out of bed 3 or 4 times a day after surgery? Not a good idea. Too much tension on the incision. And then afterwards, the silicone strips and the silicone gel.
So thank you so much for joining us for part 1 of our weight loss, after weight loss, plastic surgeries questions with Dr. Katzen. Come back next week for part 2.
Part 2.
All right, we'll see you guys.
See you.